Prescription drug abuse over the past decade has become one of the leading causes of death in the United States. And it is one of the largest epidemics we have in the United States today. In fact, deaths from drug abuse surpass deaths from guns or deaths from car accidents. So it's a huge epidemic. And what we see is that the number of people who are now going through programs to deal with prescription drug addiction have quadrupled. But part of the issue is that it's almost like people are going through these revolving doors of drug programs. And part of the reason for that is to rehab from a prescription drug addiction is a complex thing. And it's complex because people are complex. The reason we have an epidemic of prescription pain medication is because we have an epidemic of chronic pain in the United States. Over 100 million people today suffer from chronic pain. And so what we really have to look at when we're looking at an epidemic of prescription pain medications is what's going on with the treatment of chronic pain altogether. And what we're seeing is that for most people, treatment for chronic pain is ineffective. But we know that. We know that because the Institutes of Medicine have come out with one of the largest studies ever done, indicating that most people don't get appropriate care. Today, only 16% of Americans feel that we are adequately addressing the prescription drug epidemic. 37% of Americans feel that we continually lose ground in addressing the prescription drug problem. The number of women that have lost their lives to prescription drugs over the past decade has quadrupled. And 7 out of 10 of those women who die because they're taking prescription pain medications. More women suffer from chronic pain, so more women are prescribed pain medication, and they're prescribed pain medication for longer periods than men, and accordingly are at a higher risk. Addiction starts with abuse, and part of the reason for that is people who suffer from chronic pain are not getting medications that are effectively addressing their chronic pain. And in fact, what we see is 99% of the prescriptions being written for chronic pain are being written beyond the federal regulations that they should be written for. And part of the reason for that is that the treatment most people are getting for chronic pain is just limited to pharmaceuticals. And what that means is we have to move away from a limited biomedical model that is just focused on pharmaceutical, surgery, physical therapy, sometimes chiropractic and acupuncture, to actually looking at the complexities of an individual. And that's why we refer to effective treatment as a biopsychosocial approach, which is the genetic components, the biomedical components, which includes the physiological and biochemical. We have to look at the psychological components and the social components and address all of those variables if we're going to make headway and actually reverse a chronic pain syndrome. That's the same approach that needs to take place when we're addressing addictions to pain medication. We need to actually be treating all those variables, and in that manner, we're able to reverse addictions and abuse to pain medications. And that is what we've been doing here for the past 30 years. Reversing not only chronic pain syndromes, but reversing addictions to chronic pain medications. The most effective treatment for prescription drug misuse and abuse is a multidisciplinary biopsychosocial program. And that is what we specialize in for reversing addictions and chronic pain syndrome.